Hello and good morning. This is Kuldeep Chaudhary from Health in India. I'm joined by Mr. Mario Golgar, who is from Austria. He has been in India for the last 1.5 years working on a very difficult railway project in the state of Kashmir. He was suffering from a spine condition which worsened during the last month, and he was rushed to the hospital here in Gurgaon. Dr. Arun Saroha, the renowned spine surgeon, operated. He did fusion surgery on the spine. This is the 7th day from the surgery, and Mario is absolutely fine. He's been walking around. So let's talk to Mario about, what did you suddenly feel?
I felt pain in my lower back for the last 1 month before I decided finally to come to the hospital. It became really bad within the last 4 days. Until I finally left for the hospital. The initial plan was not to go to Delhi. The initial plan was to find a proper doctor in Srinagar, in Kashmir, but as there was no one in station, finally the emergency plan was to sit onto a plane and to get to Delhi. And the hospital was recommended by some fellows from our company, and with a very bad pain I arrived here, and they started all the diagnosis procedure, and suddenly, or not suddenly, and very soon it turned out that there was a severe problem with one of my lumbar discs, and and after all that it turned out that there is only one possibility, and that was surgery. And finally I was convinced by all the circumstances and by the hospitality here and by the professionality here that I should have it done here.
So did at any point of time it cross your mind that the healthcare here might not be as good and you should fly back to Austria to get it done?
Yes, in the beginning it was like that. I was scared because at the age of 36 being told that you will have to take out one of your discs is first of all not something nice. Second of all, being on the other half of the earth, having a thing like that done is not something that you would wish, for birthday.
So, when you met Dr. Saroha, did he inspire that confidence that he's a competent enough surgeon to carry out this kind of complicated surgery?
Yes, but there were a lot of emotions going on inside me, of course. So. There was doubts, but not about Dr. Saroha or any of those doctors. The doubts have been inside me, and I was mixing it up with emotions and not with something logical. But as they soon explained me in a very, let's say, functional way, how the way of decision is done in such a surgery, I was absolutely convinced and sure that those guys are knowing what they are doing.
Well, Dr. Saroha must have done several thousand spine surgeries, and he's one of the topmost in the field.
Hi. Morning. Morning.
So now I am joined by the team of doctors from the Safe Spine Surgery Center, Dr. Arun Saroha, who is the director of the center, and Dr. Gulati. These two doctors operated on Mario for the surgery. So Dr. Saroha, let us know what exactly this. I know this was a spine surgery for the lumbar spine. What exactly was the procedure?
We have done a T-lift procedure where you put in a cage and you put the screws and fuse the spine, because he had an unstable spine for the last about 5 years. He was having a chronic back pain, and then finally the disc got torn and it was lying there in the canal under the root and causing a lot of pressure symptoms. So that acute pain had to be dealt with, and we had to decide whether to go in for the minimally invasive surgery like a microdiscectomy or fuse the spine, considering that it was a L5S111, he's a young guy and he has to go and work hard. He does a lot of physical work as well. So we chose to go in for a fusion procedure.
So now Mario would be, when would he be able to resume normal activities? I've seen him walking very comfortably, standing, upright.
Yeah.
So what is the rehabilitation procedure?
I don't say that this procedure needs a lot of rehabilitation because it's a simple procedure, and as he is walking, he can do his office work starting today, and he can be driving in about 3 weeks' time, and he can do a heavy physical labor in about 8 weeks' time.
So does he require any kind of physical therapy for?
Yes, in such cases we always advise that the patient should be on some form of exercises so that the muscles of the back, the anterior and the posterior muscles around the vertebral column, they get strengthened, and there is a long time target always so that the spine does not degenerate faster.
So when you fuse the spine and put a cage around it, does it limit the movements in any way?
We put a cage between the vertebral bodies, as a result of which the movement at that level, yes, goes zero, but then that becomes a necessity, and the degree of movement which gets reduced in terms of movement is so little that a person would not relate to it much, unless it is more than a single level and multiple levels involved.
So basically, leave aside the acrobatics, Mario can do virtually everything.
I think so. Even he can do acrobat maybe a year from now if he does good physical activity to strengthen the spine muscles.
Yeah, he's been working in the mountains and he loves mountain biking. So do you recommend such kind of?
I think he can go for it as long as he's undergoing his schedule of exercise very well.
And we've seen, that's what I was talking to Mario just before you arrived, that we see very few of the European patients out there. We see India gets lots of patients from the US and then from areas like Middle East and Nigeria.
Yeah.
So have you had any different experience? You have had some more European patients coming from various
we have operated something like about 50 European patients in the last 3 years, and yes, the people coming from the African subcontinent are many more, and the Middle East countries are the maximum number of patients that we get. So I would say, in terms of the health of the spine, the European spine is one of the healthiest ones, and the Nigerian spines are the strongest of the ones, and the Middle East countries, because of the dietary and the living style, their spines are the weakest. So in terms of structure, at the same time in terms of the joints, the bone density as well.
So I was talking to Mario and he said yes, as natural, he was a little circumspect about getting the surgery done over here. So Mario, what message do you have about the Indian healthcare to the world at large now?
To the world at large, if it ever comes so far, I want to say that I'm very confident after weighing the pros and cons, and that I'm absolutely convinced about what we did here. It was from the first second to the last second up to now, it was a right decision, and I would dare to say that I would recommend anyone to come over here and have a thing like that done. I would not hesitate to recommend it, yes.
And Dr. Saroha is not much older than you, Mario, so, any word about him as a surgeon?
It's, of course, at any time adorable if persons get such big professionalists in their job at such an age.
Thank you.
Just congratulations. Yes. In the night before the surgery, I was reading about Dr. Saroha and Dr. Gulati, and I just realized how renowned they are, and that of course was contributing quite a lot to my decision making. And
so Mario, just like you are trying to put a train under the Bir Panjal mountain ranges, he almost does the same thing but in a different field, which is the medical science, and trying to fix the spine of the patients who come with lots of pain. Thank you, Mario, for talking to you.
Thank you.
Thank you, Dr. Saroha. Thank you, Dr. Gulati.